key players in the HIV/AIDS struggle, or the activists themselves, who have a passion for everyone. And they're like, HIV/AIDS affects everyone, but we need to support you people. But then they cannot still do it publicly because of the homophobic society, because of the homophobic environment. They cannot come out in the public and support us. They can't. They are afraid because they know if, for example, if they are in the media, in our campaigns, if they are on television, then they themselves are going to be attacked by the homophobic society. Their families are going to be attacked. Their own children in school are going to be called homosexuals. Because that's what happens. Every straight person who comes out and says, homosexuals, what's wrong? What have they done? They attack, the HIV/AIDS affects them like anyone else. We should put them on board. That person is going to be called a homosexual tomorrow. That person is going to be discriminated in church. That person is going to be discriminated in all the public sectors that he or she is supposed to be a member of. And that person is going to be stripped of all those membership titles he or she has in those in those other forums. And the thing is, then the other issue is, if it is an organization that is supporting us openly, supporting LGBT gays and lesbians, then renewing their NGO license is going to become a problem. Because the government of Uganda will say, you are supporting homosexuals, and it is illegal to be a homosexual in Uganda, so we cannot renew your NGO license. You cannot renew your NGO certificate. So these people are scared because of those issues. They say we cannot support you. But when it comes to maybe helping us, engage us in forums and meetings so that we can voice out our views, sometimes they do. They do help in that way. But they don't want to be named publicly that they are working with sexual minorities. They say if we take on this other, if we take the step into including the homosexuals into our group, then we're going to get issues with the laws, with the state and with the government. I think it all goes back to the laws that exist that criminalize homosexuality. Yeah, people are scared because of those laws. That's why the discrimination comes in. But then some people at heart are like, if a gay man is living with HIV/AIDS and I'm a straight man living with HIV/AIDS, then why shouldn't we be in the same social setting and see how we can fight it, how we can access treatment? But the issue is working together becomes a problem because of the laws that exist. People are aware of the success of the Uganda's past success in fighting HIV/AIDS. With all the programs we've had, people came out and faced, because at first when HIV/AIDS was first talked of in Uganda in the past, if you read literature, people were so afraid that if someone was said in the village that person is HIV positive, he would even be disowned. People would move away from that area. People wouldn't even drink from the same cup the person is using. But now it is different. People can hug someone who is HIV positive, even sleep in the same bed with someone who is HIV positive, even talk, unlike the way it was in the past. People live. People go to clinics even if they find out they're HIV positive, they still continue with life, unlike the way it was in the past. For the past years, I would say 3 to 5 years, HIV/AIDS has increased in Uganda, and because of the issues I've told you, exclusion of sexual minorities, MSM, men who have sex with men, and then the issue of the new strategy campaign that only advocates for the abstinence. Yeah, so HIV/AIDS is on the increase because of these issues. The government seems to be embarking on abstinence, which is contradictory to the program they had of ABC, abstinence, be faithful, and use of condoms. That had worked so well in curbing HIV/AIDS because people had options: abstain, be faithful, or use condoms. And this campaign was huge, and that had helped. But then, when now they are embarking on the abstinence, you're telling teenagers to abstain. What happens when they become sexually active? They're not going to use condoms because they have not been told about how to use condoms. And then this other issue of saying homosexuals do not exist. homosexuals do not exist in Uganda. Yet we know that men who have sex with men are everywhere, and they're there in Uganda, and we've told them that we are here, but then they do not want to involve them. Uganda is one of the countries that does not include men who have sex with men in the national strategic programs of HIV/AIDS. There is access to ARVs in Uganda, and recently there is a company in Uganda that is trying to make the ARVs. So if the ARVs are produced locally in Uganda, then I guess it will be easy to get the ARVs. And then, but mostly these ARVs are accessed by people who live in urban areas. Some of these people think that they will not catch HIV/AIDS if a man, if he's having sex with a man. They think there is no HIV/AIDS in anal sex. Yeah, they don't have that information. I was talking to someone who told me, I mean, the government is not telling us anything about anal sex, meaning it is safe. If they are not talking about it in the health programs, if all the billboards and all the programs are for heterosexuals, meaning for us who are having anal sex, we are safe. There's no reason to talk about it. If it was really dangerous, they would be talking about it. So that's what they think. They're like, I'm not going to make anyone pregnant, so I should have unprotected sex. People don't want to go out. They think if I go and test, I'm going to be asked a lot of questions. It takes a lot of counseling and reaching out to people. Like you find a handful, very few gay people accessing treatment and accessing VCT services because they are scared of medical places. They are scared of medical practitioners. They think they are going to be asked a lot of questions and they think they are going to be arrested. They have that ignorance in them that if I go to the hospital, I'm going to be arrested because I'm a gay man, or I'm going to be asked a lot of questions to bring the partner, or why am I even, they're going to ask you, why are you even testing? Have you had sex with someone? Can you bring that person? And so that ignorance that is around because of the homophobia in the country. We've tried to create safe spaces for counseling and referrals at our organizations. And these places, some people do not want to come because they think if I go there, the media will follow me there because they think the media knows the place. And then some people say, if I go there, every person is going to know that I am gay. People find it so difficult to come. They will call you. Like we have a safe space where people are supposed to come every Sunday from 9:30 in the morning till midday. And then what we do in the afternoon, we make them socialize. We let them socialize, watch movies, talk to each other, because we're trying to attract them to come for the morning VCT referrals and counseling. But what they do, they will call you on man and say, I couldn't come because I was so scared. People will find out who I am, and then I could end up losing my job, I could end up losing my home, things like that. So they're like, can I still get those services privately? So you have to engage maybe with a doctor, engage with someone else, and then refer this person there. I'm optimistic because even if they're introducing a stronger law, we are not going to go quiet even if the law is introduced.